So unlike in acute major traumatic injuries, we don't advise blood transfusion in acute major burn injuries. So let us see the reasons why. Acute burn injuries cause significant capillary damage. We all know that. That leads to a massive fluid shift from intravascular component to the extravascular component. So there is more fluid in the extravascular spaces. This results in hemoconcentration. So whenever we do an HB in the early post-Burns period, it always shows 16, 17, 18 or even more. So as the concentration of blood cells increases, the plasma volume decreases. So our immediate treatment priority is fluid resuscitation, typically with crystalloids like ringer lactate. So our goal is to restore the intravascular volume and to maintain the organ perfusion. We want to prevent shock rather than correct the hemoglobin levels through transfusion. It is basically an apparent hemoconcentration. So what happens if we give blood products early on? So they can exacerbate the capillary leak syndrome, wherein the fluids and protein leak are already going through the blood vessels into the surrounding spaces. So that can contribute to increased swelling, increased edema, and thereby impaired recovery. It can cause further ischemia to the skin and surrounding tissues. Therefore, blood transfusion is not advised in the acute burn injury phase. Also, there might be ongoing hemolysis due to the burn injury, due to the immune suppression because of the burn injury. Therefore, the blood transfusion may not have a demonstrable effect. So we intend to give it to improve the hemoglobin, but because of the ongoing hemolysis, there may not be a demonstrable effect. Therefore, it is not given in the early post-injury period, and it might as well be counterproductive because of the risk of transfusion reactions. So our patient is already compromised, already the immune status is compromised, and in addition, if we are giving blood transfusion, it might lead to a transfusion reaction and might be counterproductive. It has also been seen that direct thermal injury and sequestration of the red blood cells doesn't have a profound effect on the overall hemoglobin levels. Therefore, we don't do it early on. So on an average, at least at our burn center, and so far as literature is concerned, before 5 days after the acute burn injury, generally blood transfusion is avoided. Some centers it can be given as late as or even after 10 days or so, but I believe 5 to 7 days post acute burn injury is the general consensus wherein blood transfusion should be avoided. So what are the indications of early blood transfusion? I believe when burns are associated with other injuries, traumatic injuries, where there have been significant blood loss, actual blood loss to the patient. So those can be indications wherein we can give blood in the acute setting.